I'm Paul. We're going to do the patient assessment pyramid. Call comes in from dispatch, motor vehicle accident, multiple patients, one patient ejected, not moving, multiple ambulances en route. As we approach, we're going to size up the scene, checking for safety issues. Law enforcement has traffic under control. We can see a person lying face down. So our general impression is that the situation's urgent. We're going to call for ALS intercept. We're taking standard precautions. My partner and I are going to approach the patient and trying not to startle them, and my partner is going to hold C-spine as soon as possible. Hello, I'm Paul. I'm here with the ambulance. Partner's stabilizing the head. We can see blood on the scalp, but no evidence of lethal bleeds. We're going to log roll to manage the airway. No reaction to verbal stimulus. I'm going to try painful stimulus. Squeezing a muscle. No reaction to pain. Patient's AV-PU. We're going to continue with the ABCs. We've got to roll C-spine. Immobilized or maintained in line. This roll is called from the head. I got somebody else on the pelvis. I'm on the shoulders. Just called from the head on 2, 1, 2. Maintaining C-spine. I'm gonna jaw thrust because of mechanism of injury. Look, listen, and feel for breathing. Patient is breathing. I can see chest rise. Radial pulse is present. Respirations are rapid and shallow. I'm going to direct my partner to bag the patient and place an oral airway, given an opportunity. Oral airway is rejected. Patient has a gag reflex. Oral airway is withdrawn. Partner continues to bag the patient. We're going to do that. Completes our initial assessment. Now we're going to do a primary assessment that includes a 90-second head-to-toe survey. So we can see a spectacular scalp injury, but it's non-lethal, so we're going to move on. We are checking pupils. We've got a dilated pupil, not reactive to light, and one that looks normal and reactive. Checking for evidence of skull fracture. None evident. No blood from the ears. Palpate the neck. We'll place a cervical collar. Palpation of the neck was light and just searching for step-offs, any sign of fracture. We got the cervical collar in place. I'm going to expose the chest. Looking at the chest for signs of injury, and I'm going to check lung sounds. The bag is giving us good chest rise. Good lung sounds bilaterally. We're going to continue head to toe, palpating 4 quadrants of the abdomen, checking for rigidity, palpating the pelvis, checking for crepitus. None found. We're going to expose the legs, checking the legs, looking for lethal bleeds. Remove the shoes, checking for radial pulses, or rather pedal pulses. We've got distal pulses, checking the arms. Radial pulse present, that gives us a blood pressure of at least 80. This upper arm shows swelling, bruising, looks like a fracture. Radial pulse present. We're gonna complete the C-spine package by rolling the patient onto a backboard. Somebody brings a backboard in. Partner still holding cervical spine immobilization. We're going to complete our 90-second head to toe when we roll the patient toward us. Backboard on this side. Somebody's got the pelvis. I've got the shoulders. Called from the head. Rolling on 2. 1, 2. Roll to the back. Checking the back for any injuries. Nothing lethal, nothing found. Roll, backboard comes in, roll the patient back onto the backboard, position them. We're going to buckle them up get the stretcher over, get them onto the stretcher, and get them into the ambulance. In the ambulance, little can be done for a sample history, but we will, as part of our secondary survey, check for medical alert tags, neck, wrists, ankles, none found. We're going to do a complete secondary survey, including vital signs. We had a blood pressure of at least 80 because of the radial pulse, but we'll get a cuff on there, get a good number of the blood pressure. Check in on the breathing without the bag, still rapid and shallow. Continue bagging. Check for lung sounds again, 4 places. We've got skin warm and dry. We'll do an EKG. The secondary survey is going to be much more in-depth than the primary survey. We're going to check head to toe again, and we've still got the scalp injury, but the skull appears intact. We're going to look in the ears. No blood, no battle sign, no black eyes. Still got the pupil unreactive. Checking for blood, battle sign, none found. No crepitus in the face. We're going to look in the mouth. We're going to look in the nose. Jaw feels intact. Shoulder girdle, no crepitus. Got that arm injury immobilized on the backboard. Radial pulses still present. Both sides. Still got good chest rise. Palpating the abdomen again. No rigidity. Pelvis. Push. No crepitus. We're feeling, checking gloves for bleeds. Checking for decap BTLS. That's deformity, contusions, abrasions, punctures, burns, tenderness, lacerations, or swelling. So far, all we've got is the scalp and the arm and the dangerous respirations. Pedal pulse present. Pedal pulse present. Radial pulse is present. We're going to complete that set of vital signs, reassess every 5 minutes, get the ALS intercept, get to the hospital.